Okay, time for an update. In one of my other videos, I mentioned about um, how the oncologist he looked at the PET scan and um, noticed that he said to me, like, it appears in your left lung and it's just scar tissue. So that means there's just one tumor in the right lung. And I asked him, does that downgrade me from stage 4? And he said, yeah, we'll make it 3B, which, sounds better than 4 because 4 is a scary number. However, um, what was it, on the 10th, I had an appointment with the other oncologist. There's two of them that I deal with. On the 10th, I was there and she said, well, it's actually stage 4. Yeah, I'm back to 4. So yeah, there's like these emotional ups and downs, like emotional roller coaster going on. So yeah, back to 4. Yeah, because, and I said, wait a minute, I keep getting like, I always get two different stories going on here, and I forget what she said, but she said this time her and the other oncologist looked at the CT scan and basically agreed that, yeah, there is a tumor on my left lung. It's not scar tissue. Okay, so because what was it? I think a week before, I was complaining about, I had a really sore shoulder. I was hoping it's just like torn rotator or something like that. And I said, well, just to make sure, we'll do a bone scan and a CT scan. Scan your whole body. And so yeah, it was on the 10th that, well, the oncologist gave me the results and said nothing else inside your body, which is, hasn't spread to my bones or anything like that. So that's good. It's good to hear. But the bad news is you're back to stage 4. Yeah, because there is more than one tumor. There's right lung and left lung. So yeah. So as I was sitting there, yeah, it's not the nicest thing to hear. So as I was sitting there, and as my soul was slowly draining from my body from hearing that, she said, well, it's not that bad. Oh, okay, well, how so? And she said that the tumor in your right lung is only like 25 millimeters, which is about an inch. So it's not like I got something the size of a basketball growing in me. And the one on the left lung is about 9 millimeters. So that's really not bad, And she said, you're in good health, you're still young. Well, I'm 62, but I guess, the inside of me says you're still young and I'm in good shape, and which is good because she's seen people. She told me that, she says, I'll be honest with you, I've seen people in the same boat as you, and they pull through quite well with the treatment. So I figured, okay, well, we're back to 4, but it's really not that bad. And so yeah. Oh, and when I go to this one hand, it's like when I'm holding something and I rotate my wrist. I think the radiation therapy probably has affected. It was done up here in these lymph nodes, which worked pretty good. As it used to be that I would press in behind the collarbone there and I'd feel something the size of like a marble or a grape. But now it's like I don't feel nothing. So the radiation therapy they did on the enlarged lymph nodes turned out pretty good, and the results were pretty good on there. But I think, it gave me a wicked sore throat. It's like, it's not bad now compared to what it was before, but because of where the way they did it, it caused a sore throat, and trying to swallow, oh my God, it hurt. Just like I'm trying to swallow a brick. but now it's not too bad. But I think it also just affected this one shoulder, and it's kind of weak and a little bit shaky. So that's just the thing about radiation therapy. It does a lot of things to you. Okay, so so was it the 10th? Yeah, or was it, no? Actually, no. I got the results about the not the 10th, but the 9th. I got the results for the CT scan and the bone scan, and that's when she told me you're actually stage 4. That was on the 9th. Okay, so I think an MRI was ordered before that. So, and on the 11th, I had an MRI, and they were doing just my head to make sure nothing growing in my head, like no what do they call it, brain metastasis, or no, brain metastases, whatever. I have trouble with that word, metastasis. Yeah. Basically, they got to check to see if there's anything growing in my head, or it's spread to my brain. Yeah. So, so what was it? Yesterday. Yesterday, she gave me the results, and she said, you know, good news with the MRI. There's nothing in there, just my brain. So, but the oh my God, the anxiety leading up to that. You know, like the night before, a bit of anxiety, and on my way to the hospital, and then sitting there waiting for the doctor to come in. Yeah, there's a bit of anxiety. The doctor says, well, we call that scanxiety. It's a good word, scanxiety. So, anyways, yeah, so nothing else is metastasized in my body, which is good. But the, what was it? Okay, the clinical trial. Well, it has some strict criteria. One of them is white blood cell count. Now, she said that, okay, since the last blood work they did, they found that my white blood cell count is a bit low. Not dangerously low, but kind of low. And I don't qualify for the clinical trial because of the strict criteria. So she said, well, we'll wait till next week, do more blood work, and see how you do. And I have the option. So if it's like, if it's still low, then I can just say, let's skip the clinical trial. Let's just opt out and go ahead with the chemotherapy, because you can't wait forever, that's for sure, or else it will metastasize to your body. So that's what's going to happen. So next week we'll see what's going to happen. Yeah. Oh, and what they do is chemotherapy and standard immunotherapy. Now, the standard immunotherapy, I think it's got to do with there's one question people don't ask is like, why can't your T cells find cancer cells? What's going on there? Apparently, it works by the cancer cells have an outer membrane, protein based, like a lot of cells do, but it's like a cloaking shield, and your T cells can't find it. But the standard immunotherapy, apparently it's a protein inhibitor that will bring down that cloaking shield. Then your T cells can say, ah, there you are. But the clinical trial is also something that what it does is it boosts your immune system. However, there's risks in that, as in it'll go trigger happy and it'll act like, like it'll go after good cells, like an autoimmune disorder. It can do that. So, and they said most commonly you get colitis or a skin rash. So it's really not that bad, but there are other risks. Okay, so, yeah. So we're going to wait till next week and see what happens. Yeah. You know what? I got thinking. I got to be the number of scans I had. Oh my God! It's like what? Let's see. We've had PET scan, CT scan, bone scan, MRI scan, and maybe even had what was it, the ultrasound done on my leg. Yeah, pretty much scans about every way you can think of. Oh, and the stuff they've been shooting into me. Let's just pick something off the table of elements or the periodic table of elements and see what we got here. Okay, so what was it? The PET scan uses like what's it called? Fluorodeoxyglucose, so it's like a radioactive glucose. The PET or the CT scan uses iodine. The bone scan uses like, I think you call it technetium or technetium, whatever. I like to ask, what are you putting in me? And then the MRI, they said there's gadolinium. Mm-hmm. So yeah, you name it, I got it. So anyways, so yeah, that's the situation. Yeah. Other than that, today I feel not too bad. Some days I feel kind of run down and dragging my ass around, but today, yeah, not too bad. So yeah, that's the situation so far.